Ven mi pantalla, ¿no?
Sí, doctor.
Yeah. Okay, so we're going to talk about digestive system. Remember that the digestive system is also known as the gastrointestinal tract. The main function of this tract is the digestion and absorption and elimination of nutrients. Sorry, please. So the digestive system is going to prepare food, or it's going to process food for the nutrient absorption. It's going to break down food by the digestion that will later help for the absorption and finally for the elimination of the waste products. There are a lot of organs involved in the gastrointestinal tract. It starts from the oral cavity and ends at the anus. We also can talk about accessory gastrointestinal organs like the liver and the pancreas that we're going to talk later. About the stomach, it's a sac-like organ that has different parts and different cells that are involved in the digestion. For example, the parietal cells, chief cells. Do you guys know what they produce? Let's see. Alison, do you know what the parietal cells produce?
Sorry, miss, I didn't hear. My internet is bad right now.
Okay, so there are different cells in the stomach that help for the digestion. Some of them are, for example, the mucous cells, parietal cells, G cells, and endocrine cells. Do you know what the parietal cells are produce or secrete?
Sorry, miss, I didn't hear the last part. Sorry, what is it again, please?
It's okay. I will tell you. Remember that the parietal cells, they produce hydrochloric acid that is important for digestion. Then we have the chief cells that produce the pepsinogen and endocrine cells that produce gastrin that also help for the secretion of hydrochloric acid. The chyme that is released from the stomach goes into the small intestine where the absorption occurs. The majority of cases, in the stomach, the digestion occurs, and then in the small intestine, the absorption occurs. There are different nutrients that are going to be absorbed in different parts of the small intestine. For example, in the duodenum, you have the absorption of calcium and iron. In the jejunum, you have the absorption of the liposoluble vitamins like A, D, E, and K. And in the ileum, you have the absorption of vitamin B12. Something that I forgot. In the parietal cells, you also have the secretion not only of hydrochloric acid, but also of the intrinsic factor. Do you guys know what the intrinsic factor is, Ana Paula?
Sorry, miss. Can you repeat?
Do you know what the intrinsic factor is?
Factor intrínseco.
Muy bien. And what is it? It's the function of the intrinsic factor. Does someone know? Does someone want to tell me?
Teacher, the glycoprotein.
A ver, Wilfred?
Yeah, it's an element of the body that make easier the absorption of the B12 vitamin.
Very good. Muy good. Very good, Wilfred. So even though the absorption of the vitamin B12 is in the ileum, it's necessary the production of intrinsic factor. If there's, for example, an ulcer or a gastritis or a patient that is taking omeprazole, there can be a risk of a decrease of the intrinsic factor. So there's a risk for malabsorption of vitamin B12. Okay. Then, do you guys know after the exam what type of anemia is related to the vitamin B12 deficiency? Let's see. Angie, Sophia. Microcytic anemia or macrocytic anemia? Angie, Sophia.
Macrocytic anemia.
Muy bien, macrocytic anemia. Okay, so let's see what else. Then we can talk about, so we talked about the stomach where most of the digestion occurs. Also in the oral cavity by the amylase, there can be some part of the digestion, but usually it's basically on the stomach. Then in the small intestine, we have different parts of the small intestine that are related to different nutrient absorption. And then we can talk about the large intestine, or the colon, where the main function is the absorption of water and electrolytes. You have different parts. You have the ascending colon, the transverse colon, and the descending colon and sigmoid. Here we can talk about the accessory digestive organs. We have the liver that is related to, it's the one that is going to produce bile and also help with the metabolism of fat, protein, and carbohydrates and other functions, for example, like blood detoxification. Do you guys know where the bile is stored? Camila, Alison? Camila?
Excuse me, teacher, I didn't listen very well.
Okay, so do you know where the bile is stored? This. Where is the bile stored? Where is the storage of the bile?
It's near to the liver.
Near to the liver, where? Do you know how it's called, that organ? Does someone want to answer? Dagira?
Teacher, la vesícula.
Muy bien. So how do you say vesícula in English? In English?
Gallbladder.
Very good. So you have the gallbladder where the bile is stored, and sometimes we have a pathology related to the inflammation of the gallbladder that is called the cholecystitis. When there are gallstones, okay, that are inflamed and that block the duct and can cause this cholecystitis, and even a complication of this can be a pancreatitis. So later on, we're going to talk about how the pain is. Where do you think the pain from a cholecystitis is located? Where do you think it's located? Let's see, Eddie? Anybody? No? Does someone want to tell me where do you think the pain from a cholecystitis is located? We talked about the quadrants in the stomach. Is it in the epigastric, hypochondrium?
Epigastric.
No, epigastric is when we talk, for example, about gastritis. Let's see, Marcos.
Superior epicondria.
Here in the hypochondriac region. Okay, this is important when you guys are going to be like in a few years when you have to go to the hospital and do your internship. You will remember this. Okay, let's continue. Wait, okay. So we talked about the cholecystitis, that is the inflammation of the gallbladder, and then we can talk about hepatitis, that is the inflammation of the liver. Do you guys know some causes of hepatitis? You have been vaccinated in relation to one of the causes. Have immunized, yeah. Let's see. Do you know causes for hepatitis? Andrés Coronado. A ver, Anel.
One of the main causes is alcohol and also viruses, toxins.
Very good. Muy bien, Anel. So you have an alcoholic hepatitis, no? You can have also a hepatitis related to virus, Hep B, Hep C, Hep D, Hep A. You also can have, because of toxins or some medications can cause this. For example, let me see, some medications that you use for fungal infections can cause severe hepatitis. Then fatty liver disease, that is common, for example, in patients that have metabolic syndrome, that are obese. They also can have a type of hepatitis. Then we can talk about pancreatitis. The pancreas, like I told you, a complication of a cholecystitis can also be a pancreatitis. Remember that the pancreas has different types of functions. We have an exocrine function that is related basically to the digestion process, and the endocrine function that is related to hormone secretion, basically to the insulin and glucagon secretion. So do you guys know what is the disease where there's a malfunction of the insulin? Does someone want to tell me? Amy Bejarano.
Miss, I didn't listen.
So do you know the name of the disease where the insulin doesn't work?
Diabetes.
Very good. Diabetes. So do you think a pancreatitis can cause diabetes? Does someone want to answer? Carolina?
Yes, doctor.
Do you think a pancreatitis can cause diabetes?
Yes, it can cause diabetes.
Diabetes, no? It depends on the severity of the pancreatitis. If it's if it's a mild pancreatitis, there's no risk. But in some cases, there has been diabetes after a severe pancreatitis. Okay, so what else? We can talk about gastritis. In the practice class, we're going to talk about a complication of a gastritis that is double pylorus. So some causes for basically acute gastritis is NSAIDs and alcohol and H. pylori infection. Do you guys know what NSAIDs are? Someone wants to tell me?
Inés, doctor.
Very good. Inés, ¿y en inglés cómo sería?
Anti-inflammatory drugs.
Yes, very good. Non-steroidal anti-inflammatory drugs. That is a very common cause for an acute gastritis. The patient in this case, the location of the pain is basically in the epigastric region, and then it can radiate to different parts of the abdomen. It can be also associated to nausea, vomit, hematemesis, and melena. So do you guys know what hematemesis is? Let's see, Daniela Calderon.
Miss, I don't know.
So hematemesis is when you vomit blood. That's a complication or of a gastritis, well, basically of an ulcer. Then, do you guys know what melena is? Durbi? Or who's reading? Sebastián Cárdenas.
Yes, doctor.
What is melena? What is melena?
Melena means dark depositions.
Yeah. So it's called tarry stools. The T-A-R-R-I-Y, tarry stools. I think it's spelled like that. Let me check. Tarry stools. Yeah. Como brea. So you spell it like this. Let me put here. Tarry stools. Okay. Okay, then another type of pathology related to the abdomen is appendicitis, when there is an inflammation of the appendix. Here you have a typical pain that starts in the epigastric region and then radiates to the right iliac region. It's also related to nausea, vomit, anorexia, and there can be low-grade fever. A complication of an appendicitis is a perforation causing a peritonitis. So this is like the summary of what we talked about, basically about the pain location. Remember this for the exam, okay? So the cholecystitis starts, the pain is located in the right hypochondriac region. Then in that gastritis, it's located in the epigastric region. For pancreatitis, it can be located in the epigastric or in the umbilical region, and then it has a band-like radiation. So it goes like a belt. And the appendicitis, the pain starts in the epigastric region, and then it goes to the right iliac region, okay? This is important. Remember this for the exam. Then we have some vocabulary. You guys know the doctor that is involved or specialized in the gastrointestinal tract is called a gastroenterologist. The digestion is the process in which the food is broken down so we can use the nutrients. Peristalsis is a wave-like contraction that occurs in all the gastrointestinal tract, in the stomach, in the esophagus, in the intestines. Then pyrosis is also known as heartburn, and it's the sensation that of the hydrochloric acid that goes into the esophagus. This is also called reflux. Reflux. And jaundice, I think we talked about this in class, the yellow discoloration of the skin. Dysphagia is when there's a difficulty swallowing. Hematemesis when you vomit blood, and hyperemesis when there's an extreme persistent vomit. Do you know what condition is related to hyperemesis? Can you think of one? Nadia?
What is that cause?
What?
Could you repeat that question, please?
What condition can be related to hyperemesis?
I mean, what it for what it is caused?
Yes.
Like
Can you tell
vomiting
me?
or diarrhea?
No, it's vomiting. But do you know a condition that is related to persisting
Meningitis.
vomiting? No,
Oh.
yes, meningitis. But I was thinking about this early stages in the pregnancy, and it's called morning sickness, hyperemesis gravidica. That. Okay, very good. So now we're going to talk about the urinary system. The urinary system performs many functions. It's going to maintain the water balance and electrolyte balance. It's going to filter the blood and also filter the waste products and excessive fluid. So we have the kidneys and other organs involved are the urethra and the ureter. Again, here is the bladder. So here we can talk about UTIs. Oh, sorry. Yeah, UTIs. That is urinary tract infections. The location of the pain is in the flank, okay? And this is important. And the diagnosis is made by urine analysis, or it can be made by urine dipstick. That is this. So this is different elements that can be found on the urine, and you can make a diagnosis with this. For example, if you find leukocytes in the urine, we can talk about UTIs, about infections. The same if we find nitrate in the urine, we talk about infections. What do you think if you find protein in the urine? Do you know what that is called? Protein in the urine? There's a specific name.
Proteinuria.
Very good. Proteinuria. So there are some diseases that are related with proteinuria. Does someone know some of them? There are different diseases, a lot.
When you have a kidney dysfunction?
Kidney dysfunction, yes. For example, glomerulonephritis, glomerulonephritis, that can cause proteinuria. It causes, it's called nephrotic syndrome when there's a lot of protein in the urine, more than 3 grams. There are other diseases, for example, diabetes, for example, hypertension. It's also related to that. Then we can talk about blood in the urine. Do you know some causes for blood in the urine? Someone wants to tell me? Marcos?
Um, um, I, mm, I found that in the says that the letters is ATPKT is a dominant polycystic kidney disease in the
Okay, disease, very good.
yeah.
Oh, this is a kidney disease, yes. That, and also, for example, that's a common cause, but there's like a common cause. For example, it's kidney stones. So sometimes you have some blood in the urine. It can be also related to infections, but also to kidney stones, and like Marco says, to polycystic kidney disease. And then ketones in the blood. When do you think we can find ketones? Does someone know? Brenda? Brenda Brigitte?
Can you repeat the question, please?
When do you think you can find ketones in the urine test, the urine dipstick?
Yes.
When? What is key?
When you don't, maybe when you don't eat for a long time.
Oh, it's not when you eat. Let's see, Nadia, you know?
It is when your body starts using fat instead of carbohydrates.
When there's actually, when you have diabetes, you can have
Yes,
ketos
so you
in the
can use
urine.
glucose.
Another cause is not when you eat, Brenda, but when you fast. Al revés. Do you guys know what fast is?
Ayunar.
Ayunar, muy bien. Entonces, causas de, por ejemplo, cetonas en orina es diabetes, una cetoacidosis diabética, también es alcohol y otra causa es el ayuno. Okay. And glucose in the blood, when do you think we can find glucose in, sorry, not in the blood, in the urine?
Also in diabetes.
Yes, very good. Diabetes or when there's a large ingestion of carbohydrates. For there to be blood in the, for there to be glucose in the urine, the blood glucose has to be over 180. Okay, that's it. I think that's, no, and then we can talk about the physician who specializes on treating kidney disease, or the physician that specializes in the genitourinary system, that is the urologist. Then anuria, when there's absence of urine formation, or liguria, when there's a small amount of urine formation. Dysuria, that is on what you present when you have UTI. It's pain, you know, or a burning sensation when you urinate, burning. Okay. Edema, when there's excessive fluid. Incontinence, the inability to control the urine or feces excretion. Renal colic, that is related to nephrolithiasis, that it can have blood in the urine. And benign prostatic hypertrophy that is common in men. That's it. Remember that some of these questions from the learning exercises can be in the test, so you should try to do some, or at least take a look at them. Okay, that's it. So I already put the class for the practice class for the next week. For next week, you guys have it. It's a video that you have to do a presentation, and that's it. Does someone have any questions? No? ¿Preguntas?
Me, doctor.
Sí, Sebastián.
Okay. What does band-like reaction mean?
What is what?
Band-like reaction.
Where does it say that?
When you mentioned about pancreatitis and the
Sorry, a band. No, band like. The
yes, what
pancreatitis.
band-like?
So, band like in Spanish. Este cuadrito es importante para que cuando ya estén en el internado se acuerden dónde es la localización de los dolores. Entonces, en la pancreatitis, el dolor comienza en la región periumbilical o en el epigastrio y tiene una irradiación en cinturón. A band-like, de B-A-N-D, lo voy a escribir acá. Así, band-like radiation. It radiates like band-like. It's radiated like a band-like, así como una banda, así. Like a belt, así es la irradiación del dolor. Las diapositivas que están colgadas las voy a modificar para estas, las que hemos hecho un par de apuntes, ¿ya? ¿Me has entendido, Sebastián?
Yes.
Okay. Another question? ¿No? Ya. Esta chica.
Doctora,
Sí,
disculpe, ¿esta semana entonces hay prácticas?
sí. Pero esta semana la práctica la hacemos juntas. Leemos un artículo. Leemos un artículo juntos, no tienen que preparar nada. Para la siguiente, sí. Creo que harán pues dos presentaciones, tampoco para agobiarlos. Y las demás pues las haremos juntos, haremos un resumen.
Ya, gracias, doctora.
¿Ya? Ya está, entonces si tienen alguna duda pues me escriben. Y nada más. Entramos, Liz, luego en 5 minutos con tu grupo. ¿Ya?
Ok.
Ya. Chao, chicos.
Chao,
Adiós, doctora.
Hello, doctora.
Hasta luego.
Solo doctora.
Goodbye.
Hasta luego,
Hasta luego,
doctora.
doctora.
Hasta luego, doctora.